Next is item number 13, SB 614, Leno. Senator Leno.
Mr. Chair, committee members, first of all, let me accept the suggested amendments as author amendments. And what the bill does is very simply establish a comprehensive framework for California to certify peer, parent, family support service specialists under our Medi-Cal program. So a peer provider is someone who uses his or her lived experience along with training that's provided for mental health or substance abuse disorder and recovery so that we can better serve communities in need. A parent or family peer support specialist is accordingly a family member who has experience that they can share as dealing with communities in need of services. California amazingly has no standard or definition for peers, despite the fact that peers are currently serving the state very well in many capacities. But because we don't have standards and because we don't have a definition, because we've not applied to CMS, we don't get a 50% federal match, which is money we're leaving currently on the table. 30 other states are ahead of us in moving forward in this direction so that they are currently getting these federal dollars. Yet another reason why California is a donor state and not a recipient. The bill would implement the federal CMS requirements and incorporates policy work conducted by the Working Well Together Task Force. So these are folks who have come together and have been working on this very issue for quite a while now. The administration has recognized the need for peer support services. They've included in their recently released 1115 waiver, Medi-Cal 2020, and we believe that this legislation can serve to facilitate its implementation. So the bill makes sense fiscally, makes sense from a policy perspective, and can serve to provide more comprehensive service to people in California who are in need. So I would ask for your aye vote on the amended bill before you.
Move the bill.
We have a motion. We have a second. Thank you, Mr. Senator. Witnesses in support.
Good afternoon. Adrienne Shilton with the County Behavioral Health Directors Association. We represent the public behavioral health authorities in counties throughout the state. We are the proud sponsor of this legislation and would like to commend Senator Leno and thank him for his leadership to establish a peer, parent, and family support certification program in our state. We also really want to thank the Assembly Health Committee and your expert staff for helping us with the amendments that we are taking today. We think they enhance the bill significantly, so thank you for that. As noted by the California Mental Health Planning Council, California is lagging behind in terms of establishing a certification for peer support services in our state. And so this legislation would set that up. We have a strong framework here in Senate Bill 614 for the certification of peer support specialists as required by the Federal Centers for Medicare and Medicaid Services to obtain federal reimbursement. The Department of Health Care Services, as Senator Leno mentioned, also acknowledges peer support services in their 1115 waiver. Counties and their contracted mental health providers employ peers, family members, and parent partners who are valued for their lived experience, lessons learned from their own recovery journey, or that from a viewpoint of a parent or a family member. The certification of this profession offers a number of important benefits. It establishes a standard a scope of practice and also a code of ethics. It offers a professional voice for peers, and it allows us to obtain federal reimbursement. It also allows for the portability of peers from one county or one program to another. Given California's renewed interest in developing a robust healthcare workforce to meet the diversity and the needs of our residents, we feel that the peer certification program goes a long way toward reaching that goal. And lastly, I would say that this legislation goes a long way to eliminating the stigma associated with mental illness. So for those reasons, today we ask for your aye vote. Thank you very much.
Further witnesses in support?
Thank you. Good afternoon, Mr. Chair and members. My name is Katera Aslami Tamplin. I am the Consumer Empowerment Manager for Alameda County Behavioral Health Care Services and part of an organization called the Pool of Consumer Champions, which are individuals within the mental health system in Alameda County representing 973 individuals. I am also on the board of the California Association of Mental Health Peer-Run Organizations, CAMPRO. We represent mental health consumer-run organizations across the state of California. I was born in Afghanistan, and I was 2 years old when my family escaped. And we came to America as refugees. I grew up in Fremont, California. My family and I experienced extreme trauma, and we were recipients of the public mental health system. I was in my early 20s when I got out of an abusive arranged marriage and lost all my support. And I was struggling with depression and suicide and suicidal thoughts when I came in contact with another peer specialist and attended a peer support program. It was life-changing for me. It was the first time that I could speak about my mental health challenges and not be judged. And I gained hope from the trained peer specialists who shared their journey with mental health recovery with me and helped me to overcome the internalized stigma I was facing. I now have a really strong relationship with my family and my community, and I spread the message of hope, and this bill is going to help take that message further. California, as Senator Leno said, is lagging in the nation, and I have a map that shows the color of where California stands. It's one of 4 that hasn't even started planning for peer certification because we need this bill passed. It's an evidence-based model of care recognized across the nation. And the current bill includes all the essential amendments to create value and meet the rigorous requirements of CMS. It's the right thing to do. It's really important that we reach more people through peer support and through all ways that we can. And so I hope you support this. Thank you.
Thank you. Additional witnesses in support.
Michelle Cabrera with SEIU California in support.
Vicki Mendoza, United Advocates for Children and Families, and I represent the United Advocates for Children and Families Parent Partner Coalition, where we have over 300 members, and we are in support.
Thank you.
Michael Beebe, United Advocates for Children California. We are a statewide family-run organization. We are in support.
Cindy Claflin, United Advocates for Children and Families. We are in support, as well as the chair of the California Mental Health Planning Council.
Pashi Michelson, LGBTQ Program Director for NorCal Mental Health America, and we are in support.
Linda Way with Western Center on Law and Poverty in support.
Hi, my name is Roscoe Mosby. I'm a disabled American veteran. I'm a member of the Pool of Consumer Champions. I'm a member of Black Men Speak, and we support SB 614, and we need an aye vote on that.
Jamie Works Right. I represent Alameda County's Network of Mental Health Client, the Best Now Peer Specialist Program, and we are in support.
Hi, Melody Parker, POCC, Alameda County, consumer, lived experience. And quickly, I'm a recovering addict. I'm a 3-time cancer survivor, and also surviving from mental health. And with that, it is quite evident that a book couldn't have got me to where I'm at, but only lived experience, especially since I live in that underserved community that is at hand. Concept. We can only give, we'll keep what we have by giving it away.
Good afternoon. Ernest Hartman III, POCC member, also commissioner, City of Oakland, also Alameda County, member of Black Man Speak, advocate for elders and also veterans. And thank you, Senator, and the group. I support.
Mr. Chairman, members, Helene Meshar on behalf of the California Association of Alcohol and Drug Program Executives in strong support. Thank you.
My name is John. I come from Alameda County, and today I'm here to ask for the peers specialist bill because peers specialist bill support mental health service. Thank you.
Ben Rubin with Children Now, very pleased to be here in support.
Kieran Savage Sangwan with the National Alliance on Mental Illness of California in support.
Ellen King on the National Alliance for Mental Illness, and I want to say that the bill will provide uniformity and consistency in training and will offer employers know that they have someone who's trained consistently for their job, and I'm in support.
Good afternoon, Naomi Wesley, a member of Pool of Consumer Champions, an outreach specialist for special messages, redefining psychosis, one lived experience at a time, a proud mother of a U.S. Marine with PTSD, so I'm a family member that understands him. Thank you for your support.
Thank you.
Hi, my name is Michelle Campbell-Mateo. I'm currently the steering committee chair of the Pool of Consumer Champions. I'm also a certified RAP facilitator, and I strongly support this bill. Thank you.
My name is Paulette Franklin. I'm a Pool of Consumer Champion, also a very well-trained peer specialist. I'm in support.
Hi, good afternoon. My name is Susan Manzi. I'm the Executive Director of Youth in Mind, a peer-run organization, and part of the Pool of Consumer Champions and strong support of.
My name is Jessica Trevina. I'm here with the Pool of Consumer Champions Transitional Age Youth. I'm also with Youth in Mind, and I am a former foster youth from Alameda County using my health education specialty and peer experience to help out. In support.
Good afternoon. My name is Joy Mara Coleman, and I'm a member of Youth in Mind in Alameda County and a member of the Alameda County Pool of Consumer Champions, and I am in support of this bill. Thank you.
Hi, Sinead Anderson with Alameda County Pool of Consumer Champions and Youth in Mind in strong support.
My name is Sally Zibin. I'm the Executive Director of the California Association of Mental Health Peer-Run Organizations. We support the bill. We supported it from the beginning. I think it's gotten better and better with each time of amendments. And I really want to thank the Health Committee for its really thoughtful analysis and its resolutions. Thank you.
My name is Shauna Sanchagrin. I'm a graduate of the Best Now Peer Specialist program in Alameda County, and I am now employed with the Alameda County Network of Mental Health Clients, which is an all peer-run mental health organization, in strong support of this bill.
Thank you. Just want to recognize that we have a lot of witnesses in support, so I want to encourage and ask all of our members of the public to state only your name, organization, and position. Then that way everyone will get a chance to speak.
Hi, my name is Dina Tyler. I'm coordinator of Peer and Family Support Services for PrEP Alameda County, Prevention and Recovery in Early Psychosis, and Bay Area Hearing Voices, and in strong support.
David Zarnecki, consumer advocate and peer facilitator in strong support.
Hello, my name is Charlene Jimerson. I'm a RAP facilitator, a certified peer specialist. I am a Bay Area Community Services ambassador, and I say support AB 614. Thank you.
Reggie Foster, Pool of Consumer Champion. Please support this bill.
Good afternoon. I'm Sideria Lewis, and I'm a Pool of Consumer Champion as well. And I thank you in advance for your support, and I support it.
Hi, Nicolette Maristella, Community Advocate at the Mental Health Association of San Francisco, and we're in full support.
Hello, my name is Lillian Turner. I'm a social worker, MPA, and a consumer and a member of the Alameda County Behavioral Health Care, Pool of Consumer Champions, and Steering Committee. I'm here in support.
Good afternoon. My name is Emily Bender. I'm the LGBTQ Program Coordinator at NorCal Mental Health America, and we are in full support.
Здравствуйте, меня зовут Максим Цимбал, я работаю в NorCal MHA, я это поддерживаю.
Mein Name ist Dilhar Abirgunasekara, I'm Radikani NorCal MHA, I'm a Bilata Sapokana. Thank you.
Sarah McDade Ting on behalf of the California State Association of Counties in strong support.
Hi, Taylor Wong, part of the Pool of Champions and part of the Asian American Committee. In support, please.
Buenas tardes, mi nombre es Graciela Medina, trabajo para la organización NorCal MHA, abogando por las familias en la comunidad y estoy aquí para apoyar esta propuesta.
My name is Joseph Bartholomew. I'm a peer support specialist for NorCal Mental Health America, and I manage a condition.
KB, and I am a peer, and I'm with NorCal MHA, and I support SB 614. Thank you.
Buenas tardes, mi nombre es Rosa Ponce, mi título es Peer Partner, trabajo con Mental Health America of Northern California y apoyo esta ley que está propuesta. Gracias.
Buenas tardes, yo me llamo Indira Infante, trabajo en el condado de Placer con NorCal MHA y estoy aquí de acuerdo con el propósito. Gracias.
Donna Seitz, representing Los Angeles County Board of Supervisors in support.
Lucinda De Rossi with the California Association of Social Rehabilitation Agencies, and we represent nonprofit organizations who work with people most seriously affected by mental health challenges, and we work with those people in the communities where they live.
Angela Pontes on behalf of the Sacramento County Board of Supervisors in support.
Nhớ trong của lúc bây giờ bịa cha của hậu luyện nhất là họ NorCal Mental Health America của cháu sẽ thử rất chạy nào.
My name is Stephanie Ramos. I'm the Administrative Operations Manager at NorCal MHA. I'm also the sibling of a young person with severe mental illness, and I support this bill.
Hi, my name is Kim Peterson. I'm a peer partner specialist with NorCal MHA, and I strongly support the SB 614. Thank you.
Hello, Huey Nguyen, a peer advocate for a Hmong Women Heritage Association in strong support.
Mike Thor, peer partner specialist for Hmong Women Heritage, and we support this bill.
Hi, Zoa Vu, Hmong Women Heritage, and I support this bill.
Hi, I'm Pamela Jordan from Alameda County Pool of Consumer Champions and African American Empowerment Committee. I am in full support.
Hi, I'm Gordon Reed, Alameda County Pool of Consumer Champion, also African American Empowerment Committee, and I'm in strong support of SB 614.
Hi, my name is Helena Lieber, and I am a member of the Pool of Consumer Champions, and I'm a graduate of the Best Now program, where I had peer specialist training, and I am support SB 614 because it's time for California to do this. Thank you.
Hi, my name is Ann Hawkins. I'm here on behalf of the Best Now Peer Specialist Training Program in Alameda County. We strongly support. 72% of our most recent class of students were people of color. We're strongly, very diverse, and very culturally competent. Thank you.
Hi, I'm Andy Murphy with the California Mental Health Planning Council, here to express our very strong support of this bill. Thank you.
Susan Gallagher, Executive Director, NorCal MHA, strong support.
Good afternoon. Andrea Crook, Client Advocate Liaison with NorCal MHA and an individual living in recovery from mental health condition, and I strongly support this bill.
Matthew Gallagher on behalf of Mental Health America of Northern California, as well as the California Youth Empowerment Network, in strong support. Thank you.
How's it going? Marcus Wolf with the Steinberg Institute. We strongly thank you for your support and have a good day.
Thank you. Rusty Seelix, California Council of Community Mental Health Agencies and Mental Health America of California in support.
Mr. Chair, members, Jean Hurst on behalf of the Association of California Healthcare Districts in support today.
Any other witnesses in support? Seeing none, witnesses in opposition.
Mr. Chair and members, Tim Shannon, representing the California Association of Marriage and Family Therapists. First of all, I want to clarify we do not have an official opposed position on this bill. We do, however, have some concerns. We met with the author's staff and the sponsor in May and laid those concerns out. Unfortunately, at this point, the concerns we raised have not been addressed. The bill notes that currently you have a large group of individuals, over 6,000 in this state, who are operating basically without a scope of practice or a curriculum. That normally is the type of issue that is dealt with by the Business and Professions Committee, where a practice act is established, particularly on the issue of scope of practice. We understand here that's not being done, and it is unusual to have those kinds of decisions made by an agency and not the legislature. Having said that, we don't oppose the bill, but we did suggest amendments to the author's staff about tightening the scope of practice to make it clear that peer counselors cannot do anything for which a mental health counseling license is currently required in California. We haven't heard whether the author is going to accept that. Apart from that, we do have a couple of other questions regarding some things that currently apply to folks who are licensed in this state, but want to make sure are at least addressed when the Department of Healthcare Services deals with these folks on a certification basis. For example, what will be the enforcement procedures that the Department of Healthcare Services will be entitled to govern unprofessional or negligent conduct? I mean, who will the consumer complain to if there's an issue? Number two, what are the confidentiality constraints and requirements within this practice? Currently, mental health licensees have to comply with the Confidentiality of Medical Information Act. Are the specialists mandated reporters, as other licensees are? And other questions that we've raised. Our concerns are also shared by the licensed professional counselors who can't be here today. Thank you.
I'm Roseanne Helms, representing the Board of Behavioral Sciences, and the Board has taken an opposed unless amended position on SB 614. The Board is supportive of the intent of the legislation, but it believes that to protect the public, it's critical that certain criteria be specifically defined in legislation, not regulations. Therefore, the Board has requested several amendments. The most recent amended version of the bill from July 6th partially addresses some of these concerns. The amended version now includes a clear definition of a peer and family support specialist, and so we really appreciate that. However, there's some other amendments that we are requesting. That includes a clearly defined scope of practice in the law, specification of the amount of supervision required, and the description of the qualifications to be a supervisor. Also, specification of the training requirements for certification. Progress has been made on this front. However, some of the core competencies that the bill lists, including psychiatric rehabilitation and trauma-informed care, may transcend into practice requiring a license. Therefore, the Board requests language to reinforce that psychotherapeutic services for which a license is not permitted. Additionally, the Board requests an addition of a fingerprinting requirement. And the Board believes that providing these amendments will provide a solid base for certification and will also allow public protection. Thank you.
Thank you. Further witnesses in opposition, name and organization only, please.
Okay. Sherry Daly with the California Consortium of Addiction Programs and Professionals. We represent 15,000 addiction counselors, and I would like to have just a moment to express why we're unopposed.
Yeah, you do have a minute left over from the previous. So
thank you. I'll make it quick then. We believe in the mission, just not the vehicle at this point. We believe that a 2-year delay to implement, plus regulations after that, would keep these services that are vital out in our community from being delivered. There's a reimbursement stream now from Medicaid. 37 states have included it in their stream, in their Medicaid programs. 35 of them have indicated a credentialing body already in existence. It is not necessary for the state of California to recreate the wheel, create another body, go through the long laundry list of things that the Department of Healthcare Services has no experience or personnel to provide the validation of tests, training requirements, the components to a professional license or certification are just not available to the staff at DHCS. We implore you to send this to a study committee or to BMP where it can be adequately addressed.
Thank you. Further witnesses in opposition, name and organization only. Ma'am?
Stacy Hiramoto, REMCO, the Racial and Ethnic Mental Health Disparities Coalition. We are at the head of a long list of people that have worked hard on our concerns. We do not oppose the bill, but we have people from out of town that came a long way to express concerns with this bill. We again want to say we're not opposed, but we want acknowledgement that the bill as written will not serve the people that we represent in our communities. I want to introduce two speakers who have years of experience.
Yeah, we have the same set of rules for both sides. So we have two witnesses who get 3 minutes each, and I actually extended a courtesy to allow you a third witness. And so the same has to go for both sides. So at this point of the meeting, we're asking for witnesses, just as the other side did, name and organization only, and to express their position on this. Ma'am?
I guess I'm opposed because I think it needs amendment, a very strong amendment to include community health worker. There's so many Californians that will not be served the way it's written right now, especially people of color. And I represent the Native American community in Alameda County, and what we consider natural helpers, elders.
Ma'am?
I guess I am opposed as written, and I would like.
So again, let me just go over this again. We have to have the same set of rules for both sides. We've had, I think, 21 items on this agenda, and we've done the same set of rules for both sides. So we're going to continue that policy because that's the policy of this committee that we agreed on at the beginning of this year and we all voted on. So that is the policy now. I will allow everybody we want to hear your position on this, but we've heard testimony on both sides. It's going to be the same for both sides. So please come up. Tell us your name, your organization, and your position. That's what we'd like to hear. If you go beyond your position, I'll shut off the microphone because we have to run the meeting the same way. We've had 17 items today. We've done them all the same way. So we're going to do this one the same way too. Ma'am, you may proceed.
Hello, my name is Beatrice Lee. I'm the president of REMCO, and I'm also the executive director of an organization called Diversity and Health Training Institute. And I am also expressing concerns for the bill as stated, and we do support
Rebecca Gonzalez, National Association of Social Workers, California chapter, just stating concerns about the community healthcare worker provision.
Thank you.
Laurel Ben Hamida, Muslim American Society Social Services Foundation, Sacramento, serving 12 languages, refugees and immigrants, expressing
And Bosley, California Black Women's Health Project, supporting REMCO's amendment.
Lynn Coiney, La Familia Counseling Center. I support it with a concern for language.
Nikki King, California Reducing Disparities Project, support the REMCO position.
Raja Mitri, a member of the Racial and Ethnic Mental Health Disparities Coalition and a board member of Mental Health America of California. I do support REMCO's position.
Thank you. Okay. Any other witnesses in opposition? Seeing none, questions or comments from the committee? Mr. Chu, then Mr. Ridley Thomas.
Thank you, Mr. Chair. First of all, thank you, Senator Leno, for bringing this forward. This is an important measure to address a lot of important needs. Wanted to give you a chance to respond to some of the concerns that have been raised, and in particular, I know that there have been some concerns raised by folks representing communities of diversity and ethnic minorities. I think we all share the desire to make sure that the specific mental health needs in our immigrant communities and ethnic communities are dealt with, particularly given the specific needs of different communities. I think as I read your bill, you address that, but if you could please address the concerns and let us know what we're missing.
Sure. Thank you, Assemblyman. And I think you do read the bill correctly. So we define cultural competence in a broad fashion that refers back to definitions of services. So if, for example, you were to look on page 6 of the bill, line 36, we define peer support specialist services to mean culturally competent services that promote engagement, socialization, recovery, self-sufficiency, self-advocacy. We require a training curriculum for all categories of peer support specialists that includes, quote, cultural competence training, along with trauma-informed care, role of consumers and family members. So everywhere along the way where we have definitions specific to services, cultural competency leads the definition. It's repeated and repeated. It encourages employment of diverse peers to reflect cultural, ethnicity, sexual orientation, gender identity, mental health services. It defines recovery to include recognition of cultural diversity and inclusion. I think you get the idea. Every step along the way, we're trying to be as sensitive as possible to cultural competency and all of the diversity in our communities throughout the state.
That was my reading as well, and I appreciate your sensitivity to that. I know there's still some discussion within the community, but I am planning to support this measure today, and thank you for that.
Right. And if I may just add, Mr. Chair, clearly we're charting some new ground here. We've taken a lot of amendments along the way. We're going to continue to work with opposition as we go forward. I wouldn't be surprised, should this get to the governor's desk and signed into law, that as it's implemented, there may be changes yet going forward. That's the way we create new things in the state. And I would argue strongly that no one's voice is being ignored or not respected through this process, and it just takes some time. We want to bring everyone along as far as we can.
Thank you. Mr. Ridley Thomas.
Yes, Senator, a new regulatory scheme and licensure and the like. Is there a fee associated with the administration of the program that's in this bill, or do you just anticipate the reimbursement will cover somehow a part of the cost of this?
We don't have any fee in the bill.
Thank you very much for the question. Adrienne Schulten, CPHDA. So we are going to be able to obtain at least a 50% federal match for the services that are provided, assuming this bill gets passed. Also, we've identified Mental Health Services Act funding in the bill and partnerships with state agencies such as Department of Healthcare Services and the Office of Statewide Health Planning and Development to collaborate with them.
So you're going to pay for it out of reimbursement? Is that what that means that you just said?
And I also would add that the counties and community-based agencies are training peers now and paying for those trainings, but are not able to obtain the 50% federal match for those services. So there are funds now. There are Mental Health Services Act funds. There are realignment funds available at the local level for these trainings for this purpose.
Senator, does the department actually want to administer this program? Have you been a part of a work group or anything similar? Talking with
Without a doubt. Yes, indeed. So, as well as, so we're talking about the Working Well Together Task Force.
Okay.
And also the administration, as I mentioned in my opening comments, had recognized the need for peer support services and has actually included that in their update to our 1115 waiver.
Oh, that's
so
the part. Okay.
They're already projecting that they want to get there. We believe this legislation will actually implement that which the governor has already initiated.
And community health workers, I don't know if you spoke to the specifics. I think you gave a general point. So what can you do to address concerns about additional peer support workers and community health workers? Is I think what I've heard from the opposition specifically. What do you intend to do to address that, whether or not they choose to agree with what you come up with?
So I think, if I heard you correctly, you're asking about the concerns about community health workers.
Yes.
Yes. So they are a separate and distinct classification of employment.
Right.
They provide important services, but different services. And one of the obvious major differences is that there's no 50% Medi-Cal match for their services. So we can't bring them in under this program as we're applying for the 50% match through CMS.
All right. Thank you, Senator. Thank you, Mr. Vice Chair.
Thank you. Mr. Chavez.
Real quick, Senator Leno, I'm concerned about unintended consequences. Love the program. Obviously, we have a lot of people doing it, helping a lot of important people. I assume your bill is here mainly to bring in more resources, money from the feds to do this.
That's a good part of it. That's not the entirety of it.
Yeah, I'm sure it's a significant part of it. But when I look at it, if we're going to be defining the scope of practice, standardized curriculum, training standards, supervision standards, and certification protocol. If we start doing all these things, and we actually, a lot of people who are supporting it, going to be no longer able to do what they're doing and the good work they're doing? Are we going to lose people? Yes? No?
That is not my understanding, no. I think a lot of what I see the future to look like is what's going on now. The difference being that we will recognize, respect, and reward the work that peer support folks are doing currently, and we'll get a 50% match.
Okay, thank
but
you,
we'll
sir.
have some standards that we don't have currently.
Thank you.
We have a motion and a second. Senator, just ask for a very brief close.
Thank you for your questions, for your patience. I'm glad to see so many folks are here and engaged in the process, and I ask for your aye vote.
Thank you for this presentation, this important bill. We have a motion to pass as amended to appropriate. Ask the clerk to call the roll.
Bonta, Mainshine.
Aye.
Mainshine, aye. Bonilla. Burke. Chavez.
Aye.
Chavez, aye. Chu. Chu, aye. Gomez. Gonzalez. Gonzalez, aye. Hernandez. Lackey. Lackey, aye. Nazarian. Nazarian, aye. Patterson. Patterson, aye. Ridley Thomas. Rodriguez. Rodriguez, aye. Santiago. Steinnorth. Steinnorth, aye. Thurmond. Thurmond, aye. Waldron. Waldron, aye. Wood. Wood, aye. 12-0.
Motion passes 12-0. Next,